Okay, so let's look at the ventilatory response to exercise. Okay, even though exercise is the most powerful stimulus for breathing, the mechanism, the receptors are unknown. Okay, if you take a subject and you have them exercise for 5 minutes and then stop, and you measure the arterial PO2, okay, it doesn't really change at all. Okay, if you measure the arterial PCO2, it doesn't change. If you measure the arterial pH, it doesn't change. Of course, the venous blood the PO2 will decrease because your muscles are consuming oxygen and taking it out of the systemic capillaries, and then at the end of exercise it comes back. But there are no known receptors in the venous system, and so it's not clear what receptors are responding to exercise. Here's a patient with hypoxemia. Their arterial PO2 is 80. They exercise, and if anything, the PO2 is going up, it's not going down. So the arterial blood gases don't change during exercise, and the stimulus, the receptors, are not known. If you look at the ventilatory response to exercise, okay, here the exercise starts at time 0 and goes through 10 minutes. At the very beginning, there's a sudden increase in ventilation, followed by a slower increase. Okay, at the end of exercise, there's a sudden decrease in ventilation, followed by a slower decrease. Okay, these two different time courses suggest that there are two different components to the response. Okay, and the very rapid response must be some kind of neural response, but it's not clear what this is. The slower response seems more consistent with some metabolic factor or something. People have proposed that there are metaboreceptors somewhere, but nobody's actually found where they are or proven that they even exist. Okay, so the system is somewhat mysterious, but in fact exercise does clearly stimulate ventilation. Here we have a subject exercising between 0 and 12 minutes. Okay, here we're looking at inspired airflow, so V dot E. Well, okay, V dot I, but similar to V dot E. Okay, so when exercise starts, ventilation increases, and at the end of exercise, it decreases again. If we look at the PCO2 of inspired air, this stays constant during exercise. And this is because exercise increased ventilation exactly in accordance with the needs of the body. Okay, so you're not accumulating CO2, you're not blowing off CO2, you've increased ventilation, exactly what you needed to do. Now there's this interesting thing, in between minutes 4 and 8, the subjects were still exercising at the same rate, but they were told to imagine that they were exercising much more vigorously than they really were. Okay? And during this imaginary exercise period, their ventilation increased. Okay, so some neurological pathway was clearly involved here. And this increase in ventilation was hyperventilation. They were ventilating more than their body needed. And you can see that this is the case because the expired PCO2 decreased. Okay, so that means that they were blowing off CO2. Their alveolar PCO2 was dropping below what it normally is. And it looks like it dropped down maybe even below 30. And then when they stopped this imaginary exercise, it came back up to normal, to about 40. Anyway, so this is pretty direct evidence that there are neurological components to the ventilatory response to exercise. Okay, so to just recap the control mechanisms of ventilation, the most powerful stimulus is exercise. You can increase ventilation 20-fold or more, massively increase. The receptors are not known, the mechanism is not exactly known. Okay, the main control factor in normal individuals is arterial PCO2. Okay, and this is detected by the central chemoreceptors. The CO2 has to diffuse across the blood-brain barrier, form carbonic acid, dissociate, form protons. The proton concentration results in a lowering of the pH of cerebrospinal fluid, and the protons are what actually stimulate the central chemoreceptor response. Okay, so this is the main factor controlling respiration in normal individuals. It's a linear response, a powerful response. Increasing or decreasing PCO2 increases or decreases ventilation. Low pH stimulates ventilation, and usually when you change PCO2, the pH changes. It's kind of hard to separate out these two responses, but low pH, even at constant PCO2, does stimulate ventilation by the peripheral chemoreceptors. And then finally, hypoxemia stimulates ventilation by stimulating the peripheral chemoreceptors in the carotid body. And this is a crucial system that kicks in sort of when all other systems fail. The central chemoreceptor response can adapt with maintained high PCO2 or at high altitude. And under these conditions, the peripheral chemoreceptors' response to oxygen is life-saving.